Hi, my name is Steve Shanks, and I am going to talk about Medicare for All. The reason I want to talk about Medicare for All is because affordable and quality healthcare is a human right. This is a view that I have developed over 15 years being an emergency room nurse. I've taken care of thousands of people, and each and every one of them deserved the care that I gave them. Unfortunately, not everybody agrees with me that affordable and quality healthcare is a human right. But I am an advocate for Medicare for all because I also want a system that is efficient and fiscally responsible. So let's talk a little bit about our current healthcare system. In 2019, in the Journal of the American Medical Association, Woodhandler and Hammelstein write that we spent $11,559 per person per year on healthcare. This is twice the amount of any other developed nation on earth. Again, in the Journal of the American Medical Association in 2019, Schulman and Milstein write that in 2017, we spent 18% of our GDP on healthcare, $3.5 trillion. This cost is projected to increase to $6 trillion by 2027. Even though we're spending twice as much, you would think that America would have the best outcomes. Yet we are number one in the number of insured citizens. We are number one in medical debt, and we have a lower life expectancy. So where does all the money go, and how would Medicare for all help? Again, Woodhandler and Hammelstein in 2019 wrote in the Annuals of Internal Medicine that 1/3 of all the money we spend on healthcare in this country goes towards administration costs and billing documentation. This totaled $304 billion in 2019 alone. These administration costs are expensive, and they offer zero value to the patient. When Medicare for All was passed in 1966, we expanded coverage to all people 65 and older, and hospitals gained more profit after this was done. When the Affordable Care Act passed, Medicaid was expanded, yet we saw no increase in wait times and no decrease in quality. Medicare currently operates at 2.2% overhead, according to Woodhandler and Hammelstein. This would save us $238 billion in 2019 alone. Schulman and Milstein also state that in a system like Medicare for All, hospitals will gain more profit by being more efficient. In our current system, hospitals gain more profit by garnering higher payments from private systems, which ultimately we pay as taxpayers and consumers. How else would Medicare for All benefit Americans? In 2015, in the Journal of Health Politics, Policy, and Law, Seidman wrote about the divorce of health insurance from employment. In our current system, private employers hire private insurance companies who then tell you where you can go to the doctor and which facilities you have access to. In Medicare for All, you will get to choose your doctor based on who you would like to treat you, and you can choose the facility that you prefer. Employers, on the other hand, that are no longer shouldered with the burden of handling the healthcare of their employees can make decisions based on business sense. Think of all the jobs in America that under our current system will never have health insurance, such as restaurant workers. With Medicare for All, every man, woman, and child will be covered. So, in conclusion, Medicare for All is often characterized by its opponents as a pipe dream, prohibitively expensive and systematically impossible. Even though it would be better for businesses, more efficient, and eliminate all of the administrative costs that we have to shoulder as consumers. Not to mention, the most important aspect of Medicare for All is that it fulfills our moral obligation to take care of our sick. The quality of our healthcare depends on selecting leaders that genuinely prioritize the health of the country over profits. We live in a pivotal time where Medicare for all is more possible than it ever has been. We have an election coming up, and I am excited to go into that ballot box and show my support for Medicare for all with my vote. And I highly encourage that you do the same. Again, my name is Steve Shanks. We're talking about Medicare for all. Thank you so much.